and today I'm going to be demonstrating inserting an IV. So the first thing that you're going to do is get your doctor's orders, and you need to verify them and look at the patient's medical records and compare to look for any allergies, what their medical history is, and go ahead and look to see what's being ordered as well, because dependent on what procedure they're having done will depend on the gauge you get. So our patient is ordered to get medication via IV, so I chose a 20 gauge needle. I walk into the room, knock, introduce myself. Hi, can you state your name and date of birth? John Smith, he's 9/18/77. I verified that. Hi, Mr. Smith, your doctor ordered for you to go ahead and have an IV inserted for medication. Have you had an IV before? Yes. Okay. And do you have any known allergies? No. And what hand do you use dominantly? My right. Okay, Mr. Smith, we're going to try to go ahead and do this in your left hand since you're dominantly right. And I'm going to go ahead and palpate on your hand. I'm going to try to find a nice resilient vein. Do you have any pain or tenderness? No. I'm going to try to choose the most distal portion of the arm in case it does infiltrate. And I found my spot. Okay, so this is where we're going to do it. I'm going to go ahead. I've already performed hand hygiene when I walked in, and I'm going to prime my tubing. I'm going to unclamp it, and I'm going to prime it. And I'm going to clamp it back. And I'm going to put the tourniquet on his arm 4 to 6 inches above where the site that I chose. Okay, and after I do that, I'm going to palpate for his radial pulse, which is still present. At this time, I would go ahead and wash my hands again and put on clean gloves. And I would cleanse the site that I chose using a circular motion. Get my needle ready. Make sure he knows that it's coming, and I'm going to go bevel up at a 15-degree angle, and I'm going to let him know that he's going to feel a sharp prick. Good. And I do see a flashback, so I'm going to go 1/8 to 1/4 of an inch more. And then I'm going to go ahead and push my catheter in up to the hub. I'm going to release my tourniquet, put pressure about 1 inch above, take my needle out. That would go in the sharps container. Hook my tubing up. Unclamp my tubing, and I would aspirate. I do see blood return, which is good, and then flush. And at this point, I would go ahead and put my Tegaderm or clear dressing on. I would go ahead and date, initial, gauge, and time the dressing. I can remove my syringe and let my tubing fall how it naturally would fall, and take some of the tape that I previously prepared and tape it. And then I could also tape again right where the base is, just for extra stability and security to the patient and myself. And at this point, I'm done. What I would document is the gauge used, the arm used, how many attempts it took, and the patient's reaction to the procedure as well.